Welcome. I'm excited to be able to talk to you about disease prevention, therapy, and longevity using stem cells. Stephen Hawking said, "Today we are on the brink of a new age in medicine, an age where we will be able to heal our bodies of any illness, all because of cells inside us which have special powers. They are called stem cells." What special powers do stem cells have? Stem cells can regenerate and are known as the body's master cells. At first, stem cells are the building blocks of all organs, tissues, blood, and the immune system, and can form a complete human baby. But after that, stem cells serve as an internal repair system for lost or damaged cells for each organ for the entire life of a person. These are known as adult stem cells. To keep it simple, when I say stem cells, I'm referring to adult stem cells unless I specify otherwise. Stem cells are the body's natural healing mechanism. If a person is injured bad enough, either internally or externally, the body recruits stem cells from the bone marrow into the bloodstream, and they mobilize to the point of injury to begin the healing process. There is scientific evidence that demonstrates a positive correlation between the number of circulating stem cells and health and regenerative capabilities. For example, when people have a heart attack, endothelial progenitor cells, which stem cells populations commonly include, mobilize from bone marrow to the heart and start making new blood vessels. In this study published in the New England Journal of Medicine, doctors measured the number of endothelial progenitor cells and stem cells in people with coronary artery disease. The higher the number of circulating EPCs and circulating stem cells, the less death the people had from cardiovascular causes. And if people had a cardiovascular event, like a heart attack, the people who had the higher number of circulating EPCs and circulating stem cells were more likely to survive. In this study, doctors followed patients who had a stroke and divided them into two groups based on their circulating stem cells. Compared to neurological function on admission, the patients with higher amounts of circulating stem cells had better neurological recovery 1 and 3 months after the stroke compared to patients who had lower circulating stem cell counts. Stem cell-based repair involves homing. Homing is migration of stem cells into other tissues, including bone marrow, blood vessels, and organs within the body in response to stress stimuli such as drugs, irradiation, ischemia, or inadequate blood flow. Homing is a rapid process usually lasting 2 to 48 hours and is not selective, which means the stem cells go to any cells expressing distress signals. The same thing occurs when you inject stem cells. In this study, researchers gave IV stem cells tagged with bioilluminating enzymes to mice under 3 different conditions. The first condition was no surgery, and the stem cells stayed diffuse and mostly did not concentrate anywhere. However, when the animals had a surgery to the chest or chest and heart, the stem cells homed to the site of injury to begin the repair process. Stem cells home to the cells that are secreting the most distress signals in a dose-dependent manner. Stem cells naturally travel IV to home to distant areas of damage. Efficiency of homing is defined as the number of cells given that successfully go into the target tissue. The efficiency of homing in stem cell treatments depends on many factors, including how the cells have been manipulated and how you administer the cells. Stem cells given IV are the same way they naturally travel and have a high homing efficiency because the circulatory system delivers oxygen and nutrients to every cell in the body, and stem cells given IV have a high probability to reach any damaged or inflamed tissue. Injecting stem cells for heart problems works in humans too. Heart function, measured by ejection fraction, increased in patients with heart failure after a stem cell infusion. This study showed that patients with migraine headaches have decreased circulating stem cells. Another study showed that patients with Alzheimer's disease had significantly lower amounts of circulating stem cells. The number of times a stem cell can divide to make more stem cells is called self-renewal. To keep your pool of stem cells plentiful, stem cells must also divide to make more stem cells. The earliest form of adult stem cells are found in the placenta, umbilical cord, and cord blood. That's important because as stem cells age, their ability to self-renew declines rapidly. Placenta or cord stem cells can self-renew approximately 2 million times. A teenage stem cell, 200,000. A 40-year-old stem cell, 1,000. And an 80-year-old stem cell can self-renew about 4 times. This is the reason younger people are preferred as bone marrow transplant donors for cancer treatments. Most donor programs target 16 to 30-year-olds and do not allow donors past age 60 because their stem cells do not help as much. The ratio of marrow cells to stem cells as we age shows 2 things. First, the repair burden for each stem cell increases with age. For example, a newborn has 1 stem cell for every 10,000 bone marrow cells, while an 80-year-old has 1 stem cell for every 2 million bone marrow cells. So each stem cell has a lot more cells to take care of as we age. Second, we get drastically fewer stem cells from harvesting our own bone marrow as we age. Not only are there less stem cells as we age in our tissues, but the stem cells' repair speeds slow with age as well. For instance, the average doubling time for a placenta or cord stem cell is 24 hours. If you take stem cells from a 35-year-old, the average doubling time is 48 hours. If you take stem cells from a 65-year-old, the average doubling time is 60 hours. The difference in doubling times may not seem that significant when you look at the hours, but because doubling is exponential and not linear, small differences in doubling times accumulate quickly. After 1 month, 1 single placenta or cord stem cell can grow to 1 billion cells on average. In a 35-year-old, 1 stem cell will yield about 32,000 stem cells on average. In a 65-year-old, 1 stem cell will grow to only 200 cells. It is important to have cells that can double lots of times. The more they can double, the more work they can do. In a comparison of stem cells from 3 different sources, bone marrow and adipose or fat tissue, from middle-aged and older adults, and cord blood from full-term births, showed stem cells from cord blood could be cultured the longest and displayed the highest proliferation capacity, whereas stem cells from bone marrow showed the lowest proliferation capacity. Proliferation capacity is clinically important as well. This study showed that people with high risk of cardiovascular events had higher rates of in vitro senescence, or loss of the cell's power to divide and grow, than cells from subjects at low risk. A decrease in stem cell function has been recently shown to play a primary role in the cause of tissue aging and multiple diseases, such as anemia, sarcopenia, or loss of muscle tissue commonly seen with age, and osteoporosis, suggesting at least part of the cause of these diseases to be an imbalance between cell loss and cell renewal. Our number of circulating and functioning stem cells determines whether our bodies are regenerating or degenerating. Without the necessary number of stem cells, you have more degeneration than regeneration. If you need 10,000 stem cells to repair something in your body, like a painful knee, and you only have 200 stem cells, you have a math problem. Also, not all stem cells are equal. So even though you can harvest your own stem cells from bone marrow or even fat tissue, the therapeutic results will be significantly limited the older you are. Younger cells multiply faster. So if you're trying to heal degenerative tissue, Using younger, faster cells can help you heal faster. Also, harvesting your own stem cells either from fat or bone are invasive procedures. I've had this done myself, and I wouldn't recommend it. Since a stem cell's age is one of the most significant things for determining a stem cell's dividing and healing potential, the young stem cells from placenta, cord, and cord blood are recommended. These are the most robust human stem cells available. Plus, it is much easier and much more comfortable to simply open a vial of placenta, cord, or cord blood cells. So to clarify, we're not talking about embryonic or fetal stem cells. No lives are being taken to undergo these therapies. We are using placenta, umbilical cord, and cord blood-derived stem cells. Since these tissues come from the afterbirth of healthy pregnancies, which were previously just medical wastes, there are no ethical or legal problems using these stem cells. The stem cells come from healthy mothers that donate their placenta, cord, and cord blood. The mothers undergo rigorous testing for any viral or infectious diseases. The stem cells are also tested for infectious disease and sterility after processing. Only about 1 in 10 placentas and cords pass these stringent tests. The tissues from mothers that pass testing are then sent to an FDA-regulated lab for processing and concentration of stem cells and other cellular growth factors. Stem cell processing is performed in a state-of-the-art cGMP clean room. cGMP refers to current good manufacturing practice, and the regulations are enforced by the FDA. cGMPs provide systems that assure proper design, monitoring, and control of manufacturing processes and facilities. Stem cell processing is designed to isolate stem cells. Every stem cell batch is analyzed for accurate cell counts and viability. Samples are held in cryogenic storage until they pass sterility and infection testing. A common question I hear about stem cells is if it is safe to use someone else's stem cells. Researchers have found that 100% of mothers have stem cells from every baby they have carried for up to 50 years in their blood and tissues. The increased stem cells are the proposed reason for mothers living longer than non-mothers. Mothers live a third year longer for each child, up to 14 children on average. Something happens after 14 children and they don't live longer, which just sounds overwhelming to me, and I guess stem cells can't fix the kind of burden that more than 14 children can bring. Also, fetal stem cells are found in diseased or injured maternal tissue, and clinical data suggests the baby's stem cells help combat their diseases. What about cancer? Do stem cells cause or increase the risk of cancer? Stem cell source matters here. Early on in stem cell research, embryonic stem cells were harvested from 4 to 5 day old embryos, and theoretically had the greatest healing potential because these embryonic stem cells could become any tissue type in the human body. But what happens is, when harvested and cultured, they always form gross-looking tumors termed teratomas, in which the cells differentiate disorderly to various tissues of the embryo and is a major hurdle for their clinical utilization. In 2011, Gira, a biopharma company, stopped their work on embryonic stem cell research and therapy. Researchers pointed out an important fact that was being ignored. Embryonic stem cell therapy is extremely immature and expensive, while being potentially dangerous. In contrast, adult stem cells, such as from umbilical cord, cord blood, or placenta tissues, are safe and practical repair cells that naturally promote healing by maintaining homeostasis. That is what they do for the fetus rather than try to form an individual human. There has not been a successful clinical trial using embryonic stem cells to date. This is an animal study, but the results are striking as noted by the title. Umbilical cord stem cells completely abolish rat mammary carcinomas. These researchers implanted breast cancer into mice and randomized them to 3 treatment groups: a control group, local umbilical stem cells injected into the tumor, or IV umbilical stem cells. Here are the results. PBS served as the control group, and once the tumors reached a certain size, they were sacrificed for ethical reasons. By days 34 and 38, the IV and local umbilical stem cell groups' tumors had completely regressed and did not return after 100 days of monitoring. Here's a picture of one of the control group's tumors and one of the umbilical stem cell group's completely regressed tumor, suggesting umbilical stem cells most likely do not cause or increase the risk of developing cancer, but may be able to treat cancer in humans as well. Umbilical stem cells attenuated human breast cancer cells growth in laboratory experiments and after implantation since then. The potent anti-cancer effects of stem cells were demonstrated in numerous in vivo experimental models, including Kaposi sarcoma, colon carcinoma, Lewis lung carcinoma, and melanoma. Recently, umbilical stem cells have been used to treat Burkitt's lymphoma, which is the fastest growing human tumor of the immune B cells. Cell proliferation, viability, and death of lymphoma cells were significantly inhibited in this study. Nature shows having someone else's stem cells in your body is not only safe, but health and life promoting. So how do you increase your number of circulating stem cells? First, if you smoke, stop smoking. Because smoking reduces your circulating stem cells. In this study, the researchers could not even detect circulating progenitor or stem cells in heavy smokers. And smoking cessation increases your circulating stem cells. But if you resume smoking, your circulating stem cells go back down. Second option is to take the nutritional supplement StemKine, made from natural extracts and fermented products including goji berry, green tea, and beta-1,3-glycan. Kine is a Greek suffix meaning to move, motion, or division. To date, there has been no nutritional supplement proven to be more effective than StemKine at mobilizing stem cells. Third, you can infuse stem cells through an IV to increase your circulating stem cells even if they are not your own, just like mothers having their children's stem cells circulating in their bodies. A number of studies have shown that unlike other sources of stem cells, cord blood stem cells are safe and do not need to be donor matched, for example with ABO blood typing, or require immunosuppressant drugs with administration to prevent graft versus host disease, which is great news because we want young stem cells. For instance, this study using cord blood stem cells showed no statistically significant serious acute adverse effects. Out of 49 patients treated with IVs or injections, temporary minor symptoms were noted, such as 3 reported a headache, 4 had a fever, 1 experienced shivering, and 1 had a skin rash. In fact, the transplanted stem cells have been reported to successfully treat severe graft versus host disease. The doctors wrote, "The clinical response was striking. The patient is now well after 1 year. Stem cells have a potent immunosuppressive effect." Although there are several stem cell choices, I mostly prefer umbilical and placenta stem cells because they have non-invasive collection and are clinically safe. They offer superior power in regards of doubling time, proliferation capacity, and repair potential. They also have anti-tumor properties and provide immune modulation activity. The anti-inflammatory and immune modulation activity of umbilical cord, cord blood, and placenta stem cells allows them to be potential treatments for many diseases previously thought to have little or no hope for improvement, like type 1 diabetes, MS, COPD, and rheumatoid arthritis. Thank you.